Be talking about extractions and bone graft. Extractions are often a scary topic for the patient. Always assure the patient that they are in great hands and good care will be taken. Comfort them as you would want to be comforted yourself. This really helps the patient to be put at ease. Prior to starting any procedure, always obtain the informed, signed consent. Check to see if there is an X-ray of the tooth that is being extracted in the patient's chart. If there are no X-rays, or if the X-ray is more than 6 months old, then retake the X-ray of the tooth that will be extracted prior to the extraction. At this point, the doctor will be asked to come into the operatory. The doctor will then anesthetize and extract the tooth. Once the tooth has been removed, remember to take a post-operative X-ray, either a PA or a pano, and let the doctor know when it's been completed so the doctor can review it. Don't forget to give post-op instructions to the patient along with the post-op gauze. And now we are also asking all our back staff to send the same post-op instruction via email to the patient. Give patient enough time to ask you questions. Also direct them on how to get their prescription medications from the pharmacy. Don't forget to enter the next visit in the patient's chart. If all treatment has been completed, the next visit would be recall. Here is an example of what an extraction kit looks like. Please make sure you have all of this available to the doctor prior to the doctor walking in to the operatory. Please note, depending on the tooth that you're extracting, the extraction forceps vary. Let's take a look at the different extraction forceps available. Molars, premolars, and anteriors have different types of forceps. Usually, when extracting a canine, most doctors will prefer either an anterior forceps or a premolar forceps. So don't forget to ask the doctor their preference. Also, ask the doctor if they would like a high-speed handpiece and a surgical burr placed or kept available for the procedure. Remember, do not call the handpiece a drill in front of the patient, as this can evoke some negative, anxious response. Oftentimes, when extractions are more involved, the dentist may decide to do a bone graft. This is a setup of bone graft material. Please remember, it is your responsibility as the assistant to alert the billing personnel to add bone graft to the extraction procedure. Please make sure you let the billing personnel know this before the doctor starts with the bone grafting procedure. Bone graft is a procedure done to maintain or increase the level of bone in a patient. Healthy bone levels are important for stability of dentures and implants. Without enough bone, both the implant and the denture will fail. The sutures we use after extraction and bone graft at our office are absorbable, so the patient does not have to come back once for them to be removed. However, the doctor may still request a post-op visit. Nowadays, this is done through teledentistry. If the patient has already consented to both extraction and bone graft prior to starting treatment, then you can bring out both these kits at the same time. This concludes the extraction and bone graft video.